Good evening and welcome to Chesapeake Public Schools Family Empowerment Webinar presented by the Office of Family and Community Engagement. I am April Darnell, one of the FACE specialists. Our office recently expanded under the leadership of Andrea Vail, Director of Engagement, along with 6 Family and Community Engagement Specialists and 2 Family Engagement Centers. Our office seeks to create meaningful partnerships in order to inspire, engage, and empower families, educators, and community agencies to support the initiatives of Chesapeake Public Schools. We are typically available Monday through Friday from 8 a.m. to 4 p.m. and can be reached by our main phone line at 757-482-5923. You can also contact us by email at face@cpschools.com. In the meantime, please check out our website at www.cpschools.com/family engagement and follow us on Twitter at CPSFace. We have several events coming up that may be of interest to you. Our first event is our Teens Summit on February 11th from 9 a.m. to 12 p.m. at Hugo Owens Middle School. Join us as we provide teens in grades 6 to 12 and their parents with useful academic and social emotional information and resources. This event is free, however, registration is required for both the teens and parents. Our next event is a Healthy Hearts in-person session for grand families and kinship on February 14th at 10 a.m. at Camelot Elementary School. Reservation is preferred. Also, on February 15th at 5:30 p.m., we will host SIB Shops at Camelot Elementary. This workshop is for students who have siblings with disabilities. Reservations are required and the event is free. Our last event I would like to talk about tonight is regarding another Grand Families and Kinship session, Helping Your Child Thrive Academically with Nancy Sweat, Director of Curriculum and Instruction. We hope that you find one or two of these workshops that may pique your interest. We are excited to have you join us tonight for information regarding Virginia Medicaid waivers, co-hosted by the Office of Exceptional Learning. Joining us tonight are transition specialists Regina Stowe, Christina Trinello, Frankie Dampier, and Sharon Willis. Additionally, we have Sarah Bailey, Education Advocacy Coordinator for the Independence Center. Before we begin tonight's webinar, I want to let everyone know that we are recording for use on our YouTube channel. Only our panelists will be seen and recorded. If you have any questions, please place them in the Q&A at the bottom of the screen. We will answer all questions throughout the webinar. At this time, I will turn the program over to Christina Trinello, Transition Specialist for Chesapeake Public Schools. Welcome, Christina. Christina, unmute yourself. Sorry.
I would like to introduce Ms. Sarah Bailey, the Educational Advocacy Coordinator and Youth Coordinator with the Independence Center, a center for independent living. The Independence Center's mission is to help people with disabilities remain in their communities. As the Educational Advocacy Coordinator, Sarah helps parents and students become advocates as it relates to their education rights through presentations and individual mentoring. She also teaches important living skills to youth ages 16 through 24 to help youth transition from high school to adult life. Please help me welcome Ms. Sarah Bailey.
Sorry, I'm trying to get it to share my screen. Give me a second. There we go. Well, like Christina said, I am the Educational Advocacy Coordinator and the Youth Coordinator with the Independence Center. We at the Independence Center do provide information about Virginia Medicaid waivers. Unfortunately, the staff person that typically does waiver information could not be here tonight. And so I am filling in with this presentation. So what is Medicaid? Medicaid purpose is healthcare for certain groups of people who have low income. And it is both a state design program within federal standards. So the federal government sets the standards and the state designs the program around those standards. So Virginia Medicaid, the General Assembly determines the state funding, and 50% from state funds and 50% from federal funds. So there are different roles. There are federal roles and state roles. The federal role is for the Center of Medicare and Medicaid Services. It's a federal agency, and you can find out more information at cms.hhs.gov. And then the state organization is the Department of Medical Assistance Services, state agency known as DMAS for the acronym, and you can find out more information about them at dmas.virginia.gov. So Medicaid programming is divided into mandatory services and not mandatory services. And so on the screen right now is a list of all the mandatory services that Medicaid is required to provide. So in all states. So these are not unique to Virginia. So health clinic, home health if eligible for a nursing facility, hospital services, lab and x-ray services, Medicaid or Medicare premium, nurse and midwife services, nurse practitioners, nursing facilities, physician services, and transportation. So these are all provided no matter where you live if you are eligible for Medicaid. I have removed this up because I can't actually see the slide. So the control bar is anyway. There we go. So Medicaid benefits. So once enrolled in a Medicaid waiver, you will receive all the benefits of Medicaid. So you will get a Medicaid card. You will get all waiver and state plan, mandatory and optional services. And you will likely be enrolled in a managed care organization. And this is known as Commonwealth Coordinate CCC Plus Managed Care. So what is EPSDT? Medicaid benefits for children under the age of 21. You must be eligible for Medicaid, must monitor to prevent health and disability conditions from occurring or worsening, and the treatment is to correct conditions, including maintenance services. So institutional placement. So institutional placements include placements such as hospitals and nursing facilities. The ICF and IDG are intermediate care facilities for people with intellectual and developmental disabilities. These have 4 or more beds, and they offer active treatment and rehabilitation, and they are regulated by federal and state government. There are currently 69 of these in Virginia, and there's one large training center in Chesapeake, and there's 68 smaller ICFs or DDs ranging from 4 to 100 vets. So the waiver, or the point of the waiver, is to waive being placed in one of those facilities. So the waiver gives states the flexibility to develop and implement the services that you would normally receive in those facilities at home or in the community. And there are two different types of waivers. The first waiver is the Commonwealth Coordinated Care CC or CCC for short, plus waiver. And this waiver does not have a waiting list, but you must meet nursing home level of criteria, and we're going to talk about what that means. And then there is the developmental disabilities or DD waiver, and there are 4 kind of buckets, or 3 or 4 kind of buckets, if you will, for the waiver. And those buckets are a building independence waiver, community living waiver, family and individual support waiver. And they all have changed their name previously in the past. But what's important to know is that the developmental DD waiver has a wait list, and all of these buckets pretty much offer similar services. And we can talk about what the differences between the two later on in the presentation. So why home and community-based care rather than a facility? Well, people with disabilities and advocates want an alternative to institutions. And it actually ends up being cheaper for people who live in community and home-based care. It prevents federal funds to be used in the community by people who would otherwise be institutionalized. And it encourages people to get back to the community too, because they are not in an institution. So waiting list, like I mentioned, the DD waiver unfortunately has a waiting list. Currently, there are 14,000 people on the DD waiver waiting list. More people need DD waiver services than money is allocated for. Requesting a screening to be included on the DD waiver list can be accomplished by contacting the Community Service Board, because they are the ones that manage the process of assigning slots to people on DD waiver list, waiting list. DD case management, development, coordination, monitoring, and modification of DD waiver support. Linked to community resources and support, people with DD who do not have an intellectual disability can choose to receive case management from the Community Service Board or from a private provider. People with DD that includes an intellectual disability must have their case management provided by a Community Service Board. And just a little anecdotal evidence, I used to be on the DD waiver, and so I chose to have my case management private with actually the Independence Center, who I now work for. The Commonwealth Coordinated Care Plus program, it includes health care coordination, and it's confusing because there are 2 separate things that share the same name of CCC Plus, and so this can be confusing. So the CCC Plus Managed Care, and that is the name for the Medicaid Managed Care Organization. So anyone on a waiver received managed care through Medicaid. But then there's a separate waiver called the 60 plus waiver. And these are the optional services that Virginia has selected to provide, in addition to the mandatory services that all states provide. Case management, dental. I remember when that was selected by Virginia because that was a big deal. Home and community-based waivers, home health, hospice, ICFDE, which are those facilities that we talked about, mental health services, optometry, PT, OT and speech, podiatry, prescription drugs, prosthetics, and psychology. There are 6 Medicaid managed care organizations. And most people with disabilities enrolled in Medicaid receive the medical Medicaid services through the managed care model. Regardless of which waiver you're enrolled in, they are probably enrolled in a managed care. But the DD waiver services are not managed by a managed care organization. And then there are a small number of people who are exempt from managed care, and they could use the DD or DCC plus waiver. And most people enrolled in the DCC plus waiver are enrolled in the DCC plus managed care. The DCC plus waiver services will be managed by your DCC plus managed care organization. If you are exempt from DCC plus managed care, your DCC plus waiver will be provided through a fee for service. So long-term eligibility is first screening, second financial eligibility. Screening for all waivers must be provided without any cost to the individual. So now we're going to talk about that home and community-based waivers, the PACE and institution. So, to qualify for these waivers, you must need long-term care, and you get an assessment and screening. And then your monthly income limit cannot exceed $2,742, and that's as of 2023. Your resource limit cannot exceed 2,000 if you're unmarried. If you're married, it's a little different. But here's the kicker. Parent income and resources do not count regardless of child's age. And that was a big one for me. And when I was going through waiver qualification, because my parents made too much money, and yet so I was not being eligible for any needs-based programming until the waiver happened. And so when my parents found out about the waiver, we applied and got screened because their income didn't count. And it was the first program of its time where their income didn't count. And so the disability determination is at the age of 18. And Medicaid Works is the program that I'm in now, because I work, like I said, I now work at the Independent Center, which was my waiver coordination agency at the time. And Medicaid Works is for people with disabilities who want to work. The downside of Medicaid Works, and I remember making this agonizing decision, is that you must decide between a waiver or Medicaid Works. You don't get both. And there are some benefits to the waiver that don't happen with Medicaid Works. For example, on the waiver, you get $5,000 a year for environmental modifications. And on Medicaid Works, you don't get that. So you kind of have to weigh the pros and cons and decide for yourself. Also, on Medicaid work, there's the potential for your hours to be cut. My hours did get cut. I don't get as many PCA hours as I did when I was on the waiver. That's the reality. But that's the decision I made because I wanted to work. But it is still a really good program because it still provides personal care, even if you are above even if you start making more. But the catcher is you need to enroll in Medicaid work before your income goes above 1,553. So you want to enroll in Medicaid work once you have a job offer. Because after you get that first paycheck, if it's above 1,553, you're no longer eligible. But ongoing eligibility, you can earn then up to $75,000 a year, and you can save up to $46,340 a year, which is way more than the $2,000 that you can save on the waiver. And now I'm going to talk briefly about special needs trust and able account. So special needs trust and able account are very important things to know about, especially if you have a son or daughter who is on the waiver, because any asset that they receive must fit within that restraint. They can never have any resources that are more than $2,000. And if it goes over that $2,000, they will lose their waiver. And I receive calls from parents all the time with horror stories like someone died and they had it in their will that Johnny would get a certain amount of money, and so Johnny was on the waiver and lost his waiver benefit. So instead of making the will or whatever or the money out to Johnny directly, you can have a special needs trust that can, so you can gift it to Johnny without directly gifting it to Johnny. Able accounts work the same way, but able accounts are more like bank accounts. And you can find more about able accounts at able.now.com. But with able accounts, there's a gift limit, a monthly. So there's a monthly gift limit. I don't know it off the top of my head, but there is a monthly gift limit. But any income in that account does not count towards their waiver benefit. And so the HIP program is a way to keep your, so if someone is on the waiver, by default, they're going to receive Medicaid. But they also, if they're young enough, might still be on the parent medical insurance plan because they are. And so HIP allowed for health insurance premium payment to be paid so that you're getting better coverage than just Medicaid coverage. So it'll just cover the premium payment. It's separate, it's a separate program, and it's separate from the Medicaid eligibility. And you can call the number 800-432-5924 if you want more information about this program. So some people may have to pay for some waiver services if monthly income is over 1,508. If required, this is known as fee for service, and patient pay is paid each month. There's an exception for people who are working if they enroll in the Medicaid work program, for example. Medicaid alternative institutional placement. Same criteria used for admission to institutions. if it's a nursing facility, then you're going to be eligible for the DCT plus waiver. If it's one of those ICF or IDD facilities, then you're going to be eligible for the DG waiver. You do not have to apply for or be placed in an institution to be screened for either waiver. You can get screened first.
Excuse me, Sarah. We have a question in the chat that's come up, and it says, which waiver program do we apply for our child that has a progressive genetic disease?
So if it's a progressive genetic disease, I would say both, but it depends on, so I always encourage parents to apply for both the DCT plus and the DG waiver, but the likelihood of getting a DCT plus waiver is if your progressive genetic disease is, I'm trying to think for the right word, warrants a nursing facility level care. So if it warrants nursing facility level care, then the DCT plus, then you are most likely for the DCT plus. If it does not warrant nursing level facility care, then you unfortunately will only option is the DG waiver. But that doesn't mean you shouldn't try to be screened for both, because the screening criteria might, I don't know what goes into screening, so I can't say that this particular disease warrants nursing home level care. That would, so I hope that answered the question. We would talk more about what entails a developmental disability in a minute. So, but, so Adam,
Thank you, Sarah.
you're welcome. So, as I mentioned before, the DG waivers have different components. So there's the building independence waiver, the community living waiver, and the family and individual support waiver. So these are the criteria for developmental disability. So this might answer the question that someone asked earlier. So you have a developmental disability if it's a severe chronic disability. It's contributed to a condition other than mental illness, and it manifests itself before the age of 22, and it's likely to continue indefinitely. And it results in substantial limitations in 3 or more areas of life activity. And so, if your disability falls under this criteria, then you would meet the criteria of having a developmental disability for waiver purposes. And on your screen right now are just examples of what might count as a developmental disability. Obviously, this is not an exhaustive list. There are some disabilities that might count, but autism, brain injury, cerebral palsy, which is my disability, Down syndrome, epilepsy, intellectual disability, muscular dystrophy, and spinal bifida. So Virginia individual DD eligibility survey, that you must do this annually after enrollment in waiver. And this is the screening tool that they use for the DD. They look at 8 areas of life activity. Infants must have in 2 or more areas. Children and adults must have needs in 3 or more areas. So the 8 areas are health status, communication, task learning skills, personal or self-care, motor skills, behavior, community living skills, and self-direction. So building it like waiver is for adults only. Individual owns or leases their own home or apartment. It's intended for people who have minimal support needs. The community living waiver are individuals live in their own home or apartment, or with up to 4 unrelated individuals, or with family, or at a licensed rep. It may include extensive support, it may include medical and behavioral support. Only waiver with segregation and sponsored residential services. So if you need segregated group homes or sponsored residential services, then you're most likely going to be put on the community living waiver. And then finally, it's the family and individual support waiver. And the individual lives in their own home or apartment, or with up to 4 unrelated individuals, or with family. It may include extensive support, and it may include medical and behavioral support. The DD waiver waiting month. Only DD waivers, which is building independence, community living, and family practical waivers, all DD waivers. So BIDR or FIS, they're all DD. You must be screened to be included on the waiting list. One waiting list for all 3 waivers. And then about 35% of all the people on the DA waiver are enrolled in the PCC plus waiver. So the DD waiver waiting list is maintained by priority level. And then priority 1, you become priority 1 when services needed within 1 year and you meet specific criteria. Priority 2, service will be needed in 1 to 5 years and you meet specific criteria. Priority 3, service not needed in the next 5 years. And so when you call the community service board to be screened, they are the ones that decide which priority level you are, and they manage the priority setting. And you can contact the CSB if you need change. I know that when a student with a disability either earned a standard diploma and so no longer is eligible for special education services, or turns 21 because then they're no longer eligible for special education services, they become priority 1 at that time. The CSB makes decisions about slots and who receives slots based on the documentation submitted when it was screened. And it's awarded to people with the highest priority needs. So the Commonwealth Coordinated Care Plus waiver, it was a combined of the elderly or disabled with technology waiver. It was effective on August 1st, 2017. And services from both of the old waivers have been combined, but the eligibility did not change. So the CTC Plus waiver is for people disabled of any age or people 65 years or older. You must meet nursing facility criteria. That's what I was mentioning. So they will be screened using the UAI. And if in a hospital, the hospital conducts the screening. They use the same assessment tool used for nursing facility placement. They assess social, physical, and health and functional abilities. It's completed by the screening team or hospital, and additional tools may be available for children. It's a combination of you need activities of daily living, behavior and orientation, mobility, joint motion, and medication administration. Nursing or medical need category, risk of placement in a nursing facility. So even though the PCC plus waiver doesn't have a wait list, you are not, it's not as open as with eligibility. It's more.
Hi, Regina.
For PCC plus waiver, when you meet nursing home level criteria. But as I said to the question, to the answer of the question, I'd go ahead and see and just see if you are eligible for that level of criteria. Because if you are, then you at least get some services while you wait for the GD waiver. So what are the services of PCC plus waiver? Well, they are adult day healthcare, assistive technology of $5,000 a year, environmental mods of $5,000 a year, personal care services, which can be consumer directed or agency. So you have a choice. So in consumer directed, you or the person receiving services, or they can appoint an employer of record, can hire their own people to be their PCAs. Agency, there are a lot of different agencies that provide home health. A personal emergency response system, or PERS, which is a button that you wear that you can hit and it will call emergency response. It's good for people who are fall risk. Private duty nursing, respite up to 480 hours a year. So respite is to relieve the primary caregiver. So respite is not additional PCA services. It is mainly to relieve the primary caregiver, whoever the primary caregiver is. And then transition services to help people transition from a nursing facility. So if they were screened in a nursing facility or in a hospital, then they might transition to the home. But they might have to modify the home. They might have to do a lot of things. So they provide money for that as well. And as I already mentioned, consumer directed services is when staff is hired by either the person with a disability or someone acting on their behalf, employer of record. If anyone has any questions about consumer directed, I did it for 3 years. So I kind of learned what to do and what not to do in hiring your own staff. Staff is not employed by an agency. The choice and control remains with the individual and sometimes their family. This is good if you want to hire family. If you want to hire people who may not have the nursing background, but know that they have compassion for your son or daughter, or the person with a disability knows that this person has compassion. I know some people with disability just hire all their friends and give them jobs, and it worked out. So it's good if you have that network of people and network of support, and they need part-time jobs. So with consumer directed services, you still have to do electronic visit verification, which, if you don't know what that is, it basically is a clock in, clock out system. It's to prevent Medicaid fraud. So basically, the aide, whoever is working, will either clock in on the client's phone or will clock in on their phone within a certain mile radius of the patient or person's home to verify that they are there and that they are working. And it's all waivers allow this consumer directive. So the community living and family and individual support waivers allow it. And they allow it for both companion, personal care, and respite. And the Commonwealth Coordinated Care Plus waiver allows it for personal care and respite. You have a right to challenge decisions and actions regarding Medicaid. The appeal must be requested within 30 days of the decision. The decision should be issued by the hearing officer within 90 days. If enrolled in CCC Plus waiver with a managed care organization, must appeal to the managed care organization first. Medicaid fraud. Medicaid fraud happens when we bill for services that were not provided or inappropriate services were rendered. Failing to comply with DMAS documentation requirements, misrepresentation or reporting of information, inaccurate reporting of household circumstances. So the MTO Health, they do the Medicaid healthcare, and they do the CCC Plus waiver coordination. The DC or IG case manager can also serve as a service facilitator. The service facilitator provides training, troubleshooting, monitoring, and assessment every 30, 60, 90 days. If the service facilitator is not required, the individual can perform that duty. So these are just the numbers where you can get screened for a waiver if you haven't already done so. So the screening number, and we only provided the one for Chesapeake because we knew we were doing it for Chesapeake public schools. But if you need a waiver like in another area, you can always call the Independence Center. We have a list. It's very easy for us to give it to you. But for Chesapeake, if you are interested in the CCC Plus waiver, the number for adults is 757-382-2008, and the number for children is 757-382-8705. And then with DD waivers, you would want to contact the Community Service Board. And for Chesapeake, that number is 757-547-9334. And I am available to answer any questions. If after this presentation you have any questions, and so you can contact me. You can email me at sbailey@independent.org. My work number is 757-351-1585, and my work cell phone number is 757-510-2772. I will say that I would encourage you also to contact Maureen Hallowell, because she is the Medicaid advocate on staff. I do educational advocacy issues. So if you have any educational advocacy issues, feel free to contact me. And if you have any youth transition issues, please feel free to contact me. Thank you.
Thank you, Sarah. At this time, we're going to give parents a few minutes to ask any last questions for Sarah. Meanwhile, don't forget, if you have any questions about tonight's webinar, to please contact Sarah at sbailey@independence.org or 757-351-1585. So Sarah, one question. So where do families get LTSS screenings?
I'm sorry, where do families get
LTSS screenings?
that? I'm that's for the LTFS. I'm not sure, but I can look that up later. I don't know.
Okay. So in order to receive waiver services, must a person already receive Medicaid?
No, and they do not have to already receive Medicaid. They can be screened for a waiver first. They
Okay.
do have to be eligible for Medicaid eventually. So they still have to meet the Medicaid financial eligibility requirements. Of course, the parent's income does not count.
Okay.
But you can get screened first. You can get assessment screened first.
Wonderful. Okay, it looks like that is all for tonight. This concludes tonight's webinar. I would like to thank Sarah Bailey for presenting information to our families regarding Medicaid waivers. Again, her contact information is listed here on the screen. This webinar has been recorded and will be uploaded to Chesapeake Public Schools YouTube page within the next several days. Thank you for joining us this evening. Remember, families and communities work better together. Thank you for joining us.